Breathe. You're not breathing.
No, I'm breathing.
So on a scale of 1 to 10, how painful is this on the face? I know it's different for each person. Okay, so baddies, I told you I have a treat for you, and this right here is called the IV Infusion, right? So
Yes.
What is an IV infusion? What does it do, and who is it for?
Okay, well, there are different types of vitamins you can infuse, and essentially receiving any vitamins by IV, it goes directly to the cell.
Okay.
Especially something like vitamin C, which we all really need now.
Yes.
Taking it orally you'll only absorb so much.
Okay.
IV is
Right to the bloodstream.
right to the bloodstream, right in the cell, and your body can absorb 50% more than
Wow.
you would take orally.
50% more? Wow. So which vitamins are in this infusion?
Okay, so what I'm going to be giving Lindsay is Triimmune Boost. So it has glutathione, which is the mother antioxidant. It has ascorbic acid, which is vitamin C,
Okay.
and it has zinc.
Mm-hmm.
Okay, so you need that balance because sometimes glutathione infusion can give you an imbalance of zinc.
Okay.
So that one just kind of is a good balance, but zinc is also great to boost the immune system.
Right.
I love glutathione because it's the master antioxidant.
Right.
It's anti-aging.
Mm.
It lightens skin tone.
Oh, okay.
Yes. In combination with vitamin C.
Mm-hmm.
It regenerates all the antioxidants. If you're taking E, you're taking C, you're taking zinc, the glutathione actually regenerates it.
Okay. Wow.
So after the vitamin C and the E has done its job,
Right.
it kind of loses
It's luster.
yes,
Right.
the glutathione regenerates.
Reboost it. Okay.
Okay.
What else is included in this vitamin infusion?
Um,
Are these
so
all
this
going
is-
in?
So I do offer the glutathione separate for some people who cannot do an IV, small veins, they don't want it. I
Gotcha.
can do that by injection mixed with the vitamin C.
Gotcha. So for the
Yes.
most part, this is a
This is what we-
combination,
yes.
and she's only getting this combination.
Correct.
So what's the benefit of these vitamin combinations? What are the benefits?
Well, the vitamin C and the glutathione, they kind of work synergistically.
Right.
Okay, so you need the vitamin C to help the glutathione do its job.
Right.
The glutathione just helps the vitamin C be even a better
Right.
partner.
So more practical life, like this is good to help you boost your immune system, give you more energy. Is it good for hair growth? Is it good for skin? What are those benefits?
So the thing about when you're taking antioxidants is because you have a lot of free radicals. Free radicals are basically bad cells.
Okay.
Okay, and you need to clear those cells out because they can turn into diseases.
Right.
Cancer, heart disease, etc. Okay, so you need antioxidants to get rid of all these free radicals.
Gotcha.
Free radicals also speed up aging.
Okay.
Okay. And aging is also hair loss, right? As the hair will turn over
Right.
more.
Right.
So the glutathione basically will regenerate the cells, improve the cells
Right.
all over.
So why should someone come in? What are they dealing with right now? And that would make them a candidate for this.
Number one, they just want to have a great immune system
Great immune system.
to fight off anything.
Good.
You will feel like Superwoman, Superman after you do this.
Really?
After a couple of
Okay.
weeks,
You heard that, baddies? During this time, you know what's going on. I'm not gonna say.
Right.
Right.
If you're feeling a little cold, your body will help you sweat it out. You'll wake up like nothing happened the next
Wow,
morning.
okay.
Okay. You will be Superwoman, Superman.
Right.
So you will have a lot on board, so your body can fight whatever it is that's trying to attack you.
Right.
And that's where you want to start. You want to be at a place of my immune system is strong.
So this is good for boosting your immune system.
And the other part is that it is anti-aging because it's regenerating and getting rid of all the free radicals, and it's regenerating the antioxidants that you already have in your body.
Okay.
Okay.
So how soon will you start to feel or see any type of difference?
In 3 weeks.
3 weeks. So how many times do I have to do a vitamin infusion IV within those 3 weeks?
At a minimum once a week.
Once a week, okay.
But ideally twice a week.
Twice a week, okay.
You can, like I said, do the injection, but it's ideal, especially glutathione is better absorbed by IV.
By IV. And how long do we sit for the IV?
Maximum 20-30 minutes.
20,
it's
30
mainly
minutes.
more for the vitamin C because the vitamin C is a little hard on the veins.
Okay.
So I can do it by IV push,
Mm-hmm.
just by having a syringe and slowly pushing it in over 20-30 minutes, or I can infuse it. So since I want to give Lindsay just a little bit more fluid, so I'm going to give her some sterile water with that at the same time. So it's going to be anti-aging for her. It's going to improve it's going to get rid of any free radicals she's having that might later on lead to diseases. It's even out any skin tone.
It just feels really good. It's like that IV refreshment.
Yes.
And last question, I want to see you do what you're going to do do you have any other vitamin combinations, or that's kind of like the one that you really...
That's the big one. The second big one is my Myers cocktail.
Myers cocktail.
Yes.
What's that?
So Myers cocktail is a reboost, B vitamins, magnesium, calcium, zinc, all in one concoction. That basically just it gives you a burst of energy right there.
Really? Okay.
And it boosts your immune system because it has all the B vitamins. It has vitamin C.
So this is for you if you're feeling really fatigued, if you've been tired lately, maybe good for postpartum or no?
Yes.
Really?
Yes.
Okay.
Right? It's just B vitamins, magnesium, calcium, just regular
And as soon as you come up, do you feel that boost, almost like drinking a Red Bull? You heard that? But it's not drinking a Red Bull.
It's all vitamins that are going directly in your cell, because that's where you want your vitamins, in the cell. You don't want them circulating out. You want them in the cell so they can work.
Right.
And do their job.
Okay. So let's see you do your job. Sorry. I'm stopping you.
That's okay. So I am starting you off on a low dose because with glutathione, the safest way is start off with just about 600 milligrams, see how you tolerate it, and then slowly build up. Okay. That's a safe way to do it, even with vitamin C. It's not my preferred location, but
I understand. Mine either.
I understand.
But I'm gonna be alright.
We all do. Just leave the brain at home.
Well, it's popping out, so it's there.
Breathe, breathe, breathe. Pinch. Okay.
Always in the butterfly and not something else.
Take, please. A little longer. That's good. That's fine.
Amazing.
That's fine. For now, let's make sure.
We dripping?
There we are.
No, I feel it.
All right, we're in business.
Yeah, I'm okay.
So I'm just gonna do a timer.
So Tamara, I know this is pretty straightforward, but is there any aftercare instructions at all? Anything she should avoid eating, drinking?
No.
So she can go out for happy hour after this.
That's not
No
something I would
comment.
do.
Live.
I'm just asking for a friend.
Yeah, she could. Okay.
But don't.
Right. Are you comfortable? Is it burning? Because I can
No,
slow it down.
no, the tape is tight, but it's alright.
Oh.
No, I think
I
we
can-
should leave it. I don't know.
I can loosen it.
Okay.
How's that?
Okay.
Better?
Yeah.
You sure?
No. It hurts. Alright, maybe slow it
let me
down.
slow, I'm gonna slow it down. The vitamin C is a little.
We're done, right? We're done here? So Tamara, you can explain what you're doing here.
Okay. So, Lindsay has this hate-hate relationship with her glabella, her lemon lines. So what I'm doing, I'm using the PDO thread that we call screws. So it's twisted around the suture, the acupuncture needle. Okay, that's good. And so when I remove it, it's gonna untwirl and plump. Hydrate, new collagen formation. So she'll start to see a minimizing of those 11 lines.
Okay.
And so this is the base, the screw. Once again, scrunch for me. Okay, great.
So if someone comes in and, sorry, I just had to ask, if someone comes in and complains about smile lines, can PDO threads help with smile lines?
Yes. Any lines in the face, if you just want to do it for prevention. This is very big in Korea. They put this all over their face to just keep building collagen, stimulating fibroblasts, just to never get wrinkles.
So anyone who's afraid of the, what I call the filler face, the bubble face, will they get that puffiness here?
No. No. Okay. You doing okay?
Mm-hmm.
Breathe. Breathe. You're not breathing.
No, I'm breathing.
So on a scale of 1 to 10, how painful is this on the face? I know it's different for each person.
I really don't have an answer because it's the end result. It doesn't matter how bad it hurts. It doesn't matter.
Does it hurt?
Sometimes.
Okay.
The last one hurt.
No, the cheeks hurt more.
Oh, that was what we did
Oh,
before.
yeah.
But today.
No, I'm okay.
Okay.
Just breathing.
So now I'm putting monos across to build like a scaffolding. Breathe.
And what is your lovely assistant doing?
So this vibrating device is basically distracting the nerves. So the nerves are more concerned with this and not with what's happening
Gotcha.
here. So they won't, the nerves won't send a pain impulse to where I'm sticking Lindsay. They'll be so worried about the device.
What's the difference between PDO threads and fillers?
So it's almost the same material, but fillers, it's a little bit more dangerous. You can't put it everywhere, like where I'm treating Lindsay right now. Sorry. You can't put fillers. Fillers is a Band-Aid. After your body absorbs it, let's say in a year, you go back to day one. This one, you're building collagen.
So the difference is the collagen building.
Yes.
So the fillers does not promote the fibroblast building.
Very minimally. They're finding some of them are doing it minimally.
Okay. But not to the extent of PDO
No,
threads.
not to the extent. And this is safer.
The look of the PDO threads is so much more natural.
Right. You'll leave here and no one will even know that you did anything.
And you continue to see it happening like
Really?
The other
Over
one.
time.
building up, yeah, in a few days.
Minimal bruising, unlike fillers. I think fillers is when you place them, you have the risk of blocking an artery. This one, you don't have that risk. It's just a thread.
Now, what if you love the shape of your face and you don't want to change it? Do we have to worry about PDO threads reshifting the shape of our face?
Only if you do it a certain way.
Okay.
No, usually no. That's a more advanced technique and it's really done purposely.
Purposely?
Yeah.
Okay.
Yeah. But you know, we could put threads in here to build this. Remember the way the face ages, you lose the volume in here.
Right.
And so everything comes down. And so by using the threads, just even these small threads here,
Right.
will build the collagen up in here and already minimize the marionette line.
How soon will she start to see results?
Immediately she'll see the results. She'll see something today. And then just day by day, she'll just start noticing it. Minimize,
More
minimize, yeah.
results. How often does she have to do this?
She can do this conservatively every 6 months,
Oh.
but she could come back in 2 weeks and do more.
Which I might.
Oh, okay. So you can
Yeah.
do as much as or as little as you want.
Exactly.
And what if
Yes.
I just stop? I do 6 treatments and I'm done because I can't afford it.
Research has shown that you'll see the buildup of collagen for even a year, year and a half after.
Really?
Yeah. Continued building of collagen.
Oh, wow.
Yeah. The only other person that cannot do this if you're allergic to dye. So this particular thread has a dye in it.
Okay.
And so you may have a reaction if you are allergic to red dye. But I'm currently looking for threads that don't have the dye.
And what is the purpose of the dye?
Just color for the suture.
Gotcha.
That's it.
What about filling out the hollows of our eyes? There's a lot of women who complain about. Really? Okay.
Yes, I've done that successfully because once again, as the face ages, everything comes down and this becomes more apparent.
Right.
So you can put filler in here. Very risky procedure.
Right.
Okay? But you can put threads in here, and threads in here, and build up collagen. And so what the thread is also doing, as I've mentioned before, is it brings blood flow.
Right.
And a lot of times this darkness is because of lack of blood flow.
Right. Okay.
Okay? But for me, I don't only just do that. I look in the nose. Do you have allergies?
Really?
Is your nasal turbinates swollen?
Oh wow. Okay.
When I look in your nose, is everything swollen and nothing is flowing?
Right.
And so I tackle it both ways. Threads in here, nasal spray to help open up the nasal passages.
Really?
Because it's like I said before, it's never just one treatment.
There's never one treatment.
And it's all, I take a holistic view. Tatiana, can I have an alcohol, please?
So what can I do?
I'm good.
What can I do in conjunction with the PDO threads for the face to improve, you know, the appearance of my face? Is there anything else that you recommend we do?
So what I highly recommend, which would have been the cherry on top, is
Right.
to add PRP to those.
Mm.
Oh, beautiful results.
Really?
Yes.
But we are.
Yeah, that's another video. Yeah.
Okay, another time.
Yes, but we
For
are
us
going to
anyway.
do that. Yeah, so we do have plans on doing that. And so you see no bruising, a little bit of bleeding. She can use some arnica if she wants. She can put ice if she wants. But I seriously doubt
I'm
she'll
not
bruise.
a nice person.
Yeah, I seriously
No.
doubt she'll bruise. Very rare with the threads.
Gotcha. And that's it. She can come back in 6 months, or she can come back next week.
Yeah,
And that's it.
yeah, she can come back in next week and just keep building the collagen. That's what it's
That's
all
it.
about. Just she's very young.
This
She's
is
pretty
exciting.
good skin. She does do Botox.
Mm-hmm.
And so what I've encouraged her to do is because Botox, it is something I offer. It's not my preferred treatment,
Mm-hmm.
but I encourage people to. All right, if you've done the Botox, but it's a Band-Aid.
Mm-hmm.
It will wear off and you will go back to day one.
Right.
Put some threads to build up the collagen.
Right.
Put some threads to build up the collagen. Do microneedling to build up collagen. And the beautiful laser and Aerolace, that's an Nd:YAG that builds up collagen.
Mm.
Okay, so all of that, it's
Multifactorial.
yes, okay. And then there's the diet.
Oh yeah.
Okay. Sugar breaks down collagen.
I know, it sucks because I have a sweet tooth.
Yeah.
I haven't had sugar in 15 days. I tried and I can't have it. My coffee,
Oh,
it's not working out.
are you eating carbs?
Yep. I lost 10 pounds though.
Oh, congratulations.
No, not a good way. I
Oh,
wasn't
just
eating.
more alcohol.
So, Tamara, that was really great. Thank you
you.
so much for inviting us into your medical spa and showing us at least a few treatments. There's so many. And honestly, this is for who? Like, who needs to give you a phone call today?
Anybody that wants to reverse aging, slow down the aging process naturally,
Okay.
who's looking for a holistic approach, who wants someone that they could trust, that's
Okay.
who should call me.
Good. Okay, you heard that, ladies. Okay, baddies? If you're in the New York area, if you're in the tri-state area, and you need someone to get you together, okay, in 2022 and beyond, please give Tamara Desvareuix a call. I'm going to include her information below in the description box. She is helping you with holistic hair growth, holistic anti-aging treatments. She is combining functional and holistic medicine. And so for my all natural girls out there that don't want to use a whole bunch of chemicals, this is definitely the place to be, okay?